Now, for the next aspect which we'll be considering in the history taking an examination in obstetrics and gynecology, we'll be looking at what is known as a past gynecological history. Now, defining terminologies, past means something that happened before. Gynecology is totally like a branch of medicine that is dealing with women stuff. So if a woman comes to you with some fresh disease condition, you are trying to also ask her previous history. Has she ever had any issue that is like a woman issue? So now let's look at the type of questions you ask, the type of things you try to inquire from this woman. So for what we have, we said that taking a gynecological history is very important if you want to overall analyze this patient 100%. So it helps to uncover underlying conditions, okay, that have affected the fertility of this woman. Okay, also conditions that probably have affected her menstruation cycle if it is regular. Then from here you can now get to see if previously she had complications with pregnancies. Do you understand? This will give you a clue. We'll talk about those clues. So purpose, why are you actually asking the woman about her past women condition issues? You want to identify if she has any condition that is possibly the condition that is coming back. You want to understand the previous issues she had. You want to access if there's risks for what complications coming up. You want to guide decisions on what you do, okay, the type of care you offer to this patient. So key components to explore. You ask about her menstrual cycle. Is it regular? Is it 28 days? How is the flow? Is there pain during the menses? Previous gynecological conditions. Has she ever had any issues in the vagina, in the uterus, in the cervix, the fallopian tubes, in the ovaries? Do you understand? You see examples of them there. Has she ever had any surgeries? Have they ever did any surgeries for her? Okay, those are the examples of surgeries you can pause to observe. The sexual and reproductive health history. Has she ever had any STIs? Okay, does she feel so much pain when she's having sex? Fertility issues or treatment issues, right? Then screening histories. Has she ever had all those pap smears, HPV tests, mammographies? Okay, so clinical integrations. So thorough past gynecological history will help you to be able to anticipate, to expect that this woman will have complications. Tailor contraceptive advice. If you are trying to advise this woman, okay, on pregnancy related issues, it will help you to be more specific. This will also help you, where you are planning for surgery, to know if risks will come up and all those, adverse effects of surgeries will actually come up. Okay.